This video provides a demonstration of the new COVID-19 screening process in the care management platform. This new feature provides you with several options to perform a COVID-19 screening prior to an appointment. The first option can be accessed while scheduling an appointment. Notice the blue button at the bottom of the appointment information screen, which will allow me to screen the patient. Once selected, the patient screening form is displayed, and I can complete this form while I'm on the phone with the patient to schedule the appointment. I have not yet taken the patient's temperature, so I will answer no, and I will complete the rest of the questionnaire. This form utilizes the ADA guidance for patient screening. Once completed, I will save the changes. Next, I'll schedule the appointment. After I click and drag the patient's name to the selected appointment time, notice the checkbox on the appointment which indicates that the screening has been completed. Notice that the next patient, Ms. Alfonso Salas, does not have a green check mark. When I check her in, I'll be notified that she may need to be screened. The message states, "The appointment record indicates that this patient may not have been screened. Would you like to complete the patient screening form now or skip the screening process?" I will select Screen Now. Since the patient is here, I will take her temperature and enter it into the temperature field, and I will answer the remaining questions on the form and then save my changes. Once saved, I'll be returned to the patient appointment screen and I can take the patient back. I can click the View Patient Screening Data link to view previously completed forms for this patient. I can click the drop-down arrow in the Date Collected field to view previous form completions. This allows me to view any form completions that were made. For example, when the appointment was scheduled, when the appointment was confirmed, or when the patient came to the practice for their appointment and was checked in. I'll check in the next patient, Mrs. April Archer. Notice that April's appointment displays a screening risk notification. It also has a COVID-19 icon, which indicates that a previous patient screening identified some risks. I'll click to view the patient screening data. Notice that the patient had a temperature of 101 degrees, so the system is prompting me that there is some risk associated with this appointment. If I choose to overlook the temperature warning, I will be prompted with a screening alert, which states that based on the responses, there was a risk, and do I want to proceed or do I want to rebook? I will click No because I might want to reschedule this appointment. If I screen the patient again at a later date, I can update the screening details. I'll select Screen Patient to access the form, and I'll enter in the temperature details. This time the patient has a temperature of 98.6. I'll answer the questions in the rest of the form, and I'll save the changes. If I go back to view the screening form, I can see that the screening was performed multiple times. The screening risk prompt will display if the patient had any area of concern identified in the screening process in the last 3 weeks. This concludes the demo of the COVID-19 patient screening process in the care management platform.